Welcome to the Ordinary Doula podcast with Angie Rozier, hosted by Hatched and Latched. Here, we explore the many layers of pregnancy, labor, birth, breastfeeding, and postpartum life through the lens of more than 20 years in a busy doula practice supporting thousands of families. Whether you are preparing for birth, navigating feeding, or adjusting to life with a new baby, this podcast is designed to offer practical knowledge, thoughtful conversation, and empowering support for the real experiences of parenthood.
Hello and welcome to the Ordinary Doula podcast. My name is Angie Rozier. I'm your host today and I have a very special guest with me. Her name is Kasha Unes and I am happy to have her with us. She is a pelvic floor PT and this is a field that I have seen in my recent year, my years as a doula. In recent years, I've seen it just feels like explode, but I've so much more awareness over the last several years for myself and for clients that I have, and I've seen such a great, it'd be a great resource for people who are pregnant or postpartum. So we want to dive into that today. Kasha, can you tell us a little bit about yourself? Tell us a little bit about your background, where you work, what you do, and then we'll dive into our topics for the day.
Yes, hello. Nice to meet you all, and thank you for having me on the podcast. So, like Angie said, my name is Kasha, and I've been a pelvic PT for 6 years now, and I'm currently working at a clinic called Reborn, which has been amazing. I've met a lot of great people and providers that are like-minded like me, so it's been a fun environment. But I really love working with people who are pregnant, postpartum. I see a little bit of everything. I see, women who haven't had babies. I see males. So I kind of see a little bit of everything. But there are definitely a lot of things out there revolving pregnancy and postpartum and labor prep that I think we're still lacking in general education, or like Andrew and I have talked about that there's sometimes too much out there. So we're trying to filter through what to focus on. So I tried to put together some highlights today for everyone.
Perfect. I think that's awesome. And so let's start with pregnancy, and give us a good idea of how pelvic floor PT can help in pregnancy. Who should see a pelvic floor PT? When should they do it? What do visits look like? Let's kind of walk through the benefits and the process.
So I think that every pregnant person should come to pelvic PT even before symptoms start. So there's a lot we can do preventatively. We do a lot of work with posture, body mechanics, strengthening, breathing, relaxation, and ergonomics. So there are certain patterns that we see as the body is changing during pregnancy that if we get on top of it sooner rather than later, we can help prevent quite a bit of issues like pain and weakness. So yeah, I get that question a lot. When can I start? So, I mean, I even see people before pregnancy, even when they're prepping for pregnancy, because people also have a lot of questions. So I think it can also be really, really helpful and validating to be able to have a space to ask those questions, especially for first-time moms.
Yeah. And I know there is a lot of common pregnancy discomforts and pains that are largely dismissed by providers, right? Like, and that's who you're going to see as a pregnant person. We're kind of scripted to see our provider 10 to 13 times, whatever the schedule is. And I hear all the time, people are like, yeah, I took this question to my provider and they dismissed it, right? So, and we know those visits are pretty short. What about some of those common pains and discomforts? Can we avoid some of those with pelvic floor PT?
Yes, definitely. So even though we do work a lot on the pelvic floor, we really specialize in the whole pelvic girdle. So we see a lot of joint pain that's common in pregnancy, especially when we start developing more laxity. So pubic symphysis pain, SI joint pain, back pain. And we, look up and down the whole chain too. So we see, feet issues like collapsed arches, like that can go up the chain. So we screen for that. Um, so yeah, sometimes we see pelvic floor pain from muscles that are too tight and weakness.
A lot of people complain about sciatica, like right
Yeah,
there. So some of these typical things we can address.
yeah, yeah.
Okay.
So sciatica is a big one. Sciatica is probably one I see most often, and I I've seen women who have had sciatica before pregnancy and then it's exacerbated. I've seen women that have not had it before and all of a sudden they're like, what is going on with my body? So even though it's good to get started early, if you don't, it's still not too late. So I have a lot of women who come in, they're like, even like 6, 7 months, like 8 months, and they're like, man, like I feel so guilty. Like I should have come in earlier and like I never want to add to the mom guilt.
Right,
Like,
right.
no, it's never too late. Like you're busy, you have a lot going on. Um, so
A lot of
yeah.
times those aches and pains don't come till later, right? When we get
Mhm,
there's some more weight to the uterus than to the baby, that's
mhm,
when the body becomes stressed.
mhm.
So it's not too late, right? We can always.
Yeah. Yeah. And even though a lot do come later, I have seen a couple of women even recently that started having pain right away, like
Mm,
early first trimester, and their doctor even said, "Oh, it's not typical to have this much pain early on, but go see pelvic PT and get it addressed." So
good.
I was happy that she got sent over, and because I think there are a lot of women um, who aren't sent to PT, or maybe they think, "Oh, maybe it's not even something that I need to bring up because this is just a normal part
It's
of
normal. We've
pregnancy."
accepted it, right? And yeah.
Yeah,
Well,
yeah.
and that's really encouraging to know that some providers are aware and sending their patients to a place that they can get help because we know those visits are pretty short. Tell us what a visit with you is like. Like we're not in and out the door probably in 5 minutes here, right? So
Mhm.
tell us kind of what we look at a visit with you or
Yeah,
somebody who
so
does your role.
pelvic PT is really nice because we do get to spend quite a bit more time with the patient. Visits usually are, at my clinic, they're 40 minutes, some clinics are 60 minutes, but the nice thing about where I'm at now is even though our visits are 40 minutes, that allows us to see patients more often. So, we can see someone twice a week, once a week, versus sometimes you'll get to a clinic that PTs are super booked out because
Mm.
pelvic PTs are very high in demand.
Yeah, it's quite popular.
So yeah. So either way, whatever time you can get with your pelvic PT, wherever you're at, you're still going to get more time than you do at your OB appointments. So, you know, when you first come in, we do a pretty thorough evaluation. There's a lot of history taking. So we're, um, talking about the musculoskeletal system, but we also talk about like lifestyle factors. Um, what's your environment like at home? Like, do you have a stressful job? Do you sit a lot?
Mm.
Childcare. And then we'll touch on, bowel, bladder, sexual function, because that can all play into it. I hear people say all the time, I don't know if this is relevant. And then they'll tell me something. I'm like, yes, that is that really helps me put things together. So
And so validating, right? That people
mhm.
are being listened to.
Yeah, yeah, totally. So, and yeah, we definitely do a movement screen. We see, how things are moving, check strength, flexibility, all those things. Depending on what you're coming in for, we can do a pelvic floor exam. If we're looking at if you, your main issues are pelvic girdle symptoms like pain or sciatica, we don't always go internal right away if we don't need to.
Mm.
But if you have some pelvic floor specific issues or we have a suspicion that, okay, pelvic floor has something to do with it, then we can do a pelvic floor exam. So, um,
And you're also sending people home with things to work on, correct?
yeah. Oh, yeah. Yeah. So stretches, exercises, and, we cater it to what we're seeing in the clinic. And sometimes you'll get people who are, pretty textbook, like, okay, we got to do like, look at your posture, glute strengthening, core strengthening. But more often than not, people are not textbook. So,
Yeah.
um, you know, we can give the general guidelines, but pretty often we're giving something unique to you as well. Um, and then what else?
So tell me on I know some people will use some devices, if you will, right? Like, tell me a little bit about supports, different supports that might be on the market. Are those recommended? Tell me your thoughts on those products.
So supports can be really helpful, especially in cases where you're maybe limited with ability to exercise or you have a lot of nausea, pain, or busy lifestyle. Um, I do like SI belts, especially if you have that pain in the front, that anterior pubic pain or the SI pain in the back. Belly band is nice when you're feeling a lot of pressure in the belly, but also back pain. Like if you feel like you're getting heavier and your weight is shifting forward, it can help to have
Mm.
some support. And I really like some options out there for perineal and groin support. I think
Mm.
that's something that's not talked about as much, but I've had people have pretty good success with that. So, um, there's one I like. There's like the baby belly band, but it is an SI belt, but then like Velcro straps that go under your perineum and cross, and
Mm.
it's actually pretty comfortable and it helps give you some more support. So I like to recommend that for my patients who have maybe they have a profession that requires a lot of standing, like
Mm.
healthcare providers, nurses, or teachers, and they can be doing their exercises, their posture, but by the end of the day, like your body gets tired,
Tired,
so
yeah.
the extra support, especially if someone's had multiple kids and they have maybe a history of prolapse, that can be really nice and supportive as
So
you go through
that
your
I've
pregnancy.
not heard of that before, but that is awesome. So I'm kind of thinking like when you're rappelling or rock climbing, like a harness, is it something kind of like that that you wear?
Yeah, kind
Okay,
of. So
okay.
it is like, and there are different ones out there. So Um, there's one called the pelvic bra, and it's like
Oh,
it kind of looks like a thong, but there's like
yeah,
extra support at the bottom.
interesting. So
Um,
you wear this under your clothes, obviously. It's
yeah, yeah,
comfortable enough. Okay,
yeah,
cool.
it's comfortable enough. Yeah, and there's what like there are ones out there that like it's like a full like set of like underwear or like a compression garment, and they have like an extra like sling on the bottom
Hmm,
that helps give you a little bit of lift.
cool.
And I've had I had a lovely patient who did so much trial and error with this. And she like got like so many different products and like uh, scoured Amazon. And she actually ended up liking just using like a compression garment one and then a thick pad, like just like a
Oh,
men's
for some
pad,
pressure
some
almost, like,
pressure, and that
gotcha.
gave a little bit of lift. And
Hmm.
So
She
I
found
thought,
what
"Oh,
worked.
yeah, she found it worked." And after
So
after
cool.
spending all that money, so I told her that I'm going to use your case to help other women not spend as much money.
Right. She did a lot of work for people, like a little case study.
Yeah, yeah,
That's really
yeah,
cool. Cool.
yeah.
And then tell me a little bit about um you said the word labor prep.
Hmm.
So how do you, as people, I mean, there's pregnancy is a long time, right? We got 9 months of that and it
Hmm.
changes. And then we're always building up to that day that you have a baby. And that's a big day. The body's doing a lot of things. People are sometimes kind of anxious about that day. How do you go about preparing people for labor as they visit with a pelvic floor PT?
So usually when they're coming in for, various issues throughout their pregnancy, like pain or strengthening or incontinence, we'll zone in on that, and we can keep labor prep in the back of our mind. Like, we want to start making sure the pelvic floor is able to relax. We'll already like do some stretches and work on mobility, especially if you have some stiffness or weakness. But I do like to have a separate labor prep visit or a couple of visits getting as we get closer. So in third trimester usually,
Mhm.
and we go over positioning, movement. Are you planning epidural or not? Because then
Mm,
that can be a bit variable in your prep. Because I've had a lot of women who are like, "Oh, I want to do all these things, and I've heard I need to do this," and then they say, "Well, I think I'm going to do an epidural. Am I still going to be able to do all these things?" And so, the answer is you still can incorporate movement, but it just looks different. So I think it's nice to already plan ahead versus, planning all these things like I'm going to do squat bar, or I'm going to do this. And
mhm,
then you get to the hospital and you're like, oh, this looks a lot different,
I'm
you
not
know?
going to.
Yeah.
That
So,
I think people oftentimes when they and most let's face it, most people get epidurals as we look at
mhm,
percentages. However, I think a lot of people just they view themselves as a static object after they get an epidural,
mhm,
right? They're a beached whale, they can't move, and that is
mhm,
not the case at all, right? So
mhm.
helping them be prepared for that.
Yeah, yeah. And actually I listened to some podcasts on some episodes on your podcast, and I really liked a few of the episodes that went over
Mm,
that more in depth, and talking about how you can still like move your pelvis to help it be in a more open position, like in different planes, like forward and back, side to side, and using gravity and things like that. So yeah, I go over things like that. We practice it in the clinic, so then it's easier for them to also figure out what will work best for them in,
mhm.
when they're in labor, because if you've never tried these
Right?
things,
If you've
you
never
get
done
there
it.
and you're like, oh my gosh, this is
Yeah.
overwhelming. And something I also really like to practice, if they're okay with it, is giving internal feedback. So doing an internal exam and giving feedback on how they're pushing. So I can check and see, okay, when you try to push or, think about pushing baby out or like having a bowel movement, what's going on with the pelvic floor? Is it
Mm.
actually opening and getting out of the way, or is it actually tightening um and going to cause some issues later on?
So that could help them be aware prior to, right, and be more effective
Mhm,
with pushing. I something I've noticed working with athletes or ballerinas or gymnasts or
mhm,
different, even different body types. Sometimes we get to the labor part where pushing, and a provider, whether it's maybe a nurse in the pushing phase, a doctor says you have a really tight pelvic floor.
mhm,
and we're right there having a baby, like, within the hour or two or three or whatever it will be.
Mhm.
And that, to a lot of people, that's a speed bump, right? They're like, oh my gosh,
Yeah.
like, is that bad? Like, what do you mean? What do I do about that? And we're in the moment, right? It's
Mhm.
feeling um, really inhibitive, honestly. And some people, it kind of stops them in their tracks, and it puts some fear in them on their providers. So, what do you do when you do work with the people who have like incredibly tight cores, whether it's their, you know, like a ballerina. Ballerinas, it's challenging. Gymnasts, like it's
Mhm.
really challenging,
Mhm.
as I've noticed working with them. So how
Mhm.
do you prepare somebody like that? Well, first of all, awareness, and then what do you do about
Mhm.
it?
Yeah, that's an awesome question, and it's cool to hear how things play out in the moment. So I see a lot of women who have tight pelvic floors outside of pregnancy, during pregnancy for various reasons, and it can take a while. Like it can take quite a few sessions, and I've had I've seen women for months, for like a year, to help stretch and relax the pelvic floor. So I think if more women knew about it ahead of
Mm,
time, it wouldn't be as much of a shock during, and
yeah.
knowing, okay, this isn't really something that you can always just tell someone relax and it
Hmm.
just relaxes, you know. It can take a lot of work. But I also, I see cases where people have like really tight pelvic floors, like tight hamstrings, right? Tight traps. So you're like, okay, I need to do some maintenance, I need to be consistent. Um, and I see some people, and yeah, in those cases, we can do a lot of manual stretching and prep work. I like to teach people how to do stretching on their own too, if they're willing. So
Hmm.
I can teach them using their own fingers or using tools like a pelvic wand or dilators. Um, but I also see a lot of people who, they might have, um, a pretty flexible pelvic floor. It's not super hypertonic to stretch, but in the presence of stressors, pain, anxiety, that pelvic floor just locks up.
Or
So
exhaustion, right? You're
for
2 days
exhaustion,
into labor.
yeah,
Yeah.
yeah. So I like to go through some of those scenarios ahead of time too. So, for example, I had a patient the other day who we were able to stretch, and she's like, "Oh yeah, that's feeling better." And then, we went a little further and we hit a pain spot, and all of a sudden her pelvic muscles, like everything just locked up.
Mm,
Um and even I went back to stretching the areas that would let go previously, and they didn't want to let go.
mm,
So we worked on breathing exercises, diaphragmatic breathing, autonomic calming, and like desensitization. And she was able to relax her muscles herself. It
mhm,
wasn't me going in and stretching and just like shoving
mm,
those muscles open. A lot of it was her and her like autonomic system and having less fear around it. So it's really cool to see like how powerful like your own body and mind can be in those scenarios.
and there's different approaches, it sounds like, right?
Mhm.
Intentional approaches to, there's more than one way to do that.
Yeah, yeah,
Cool.
yeah, totally. And I also see when it comes to pushing mechanics, you'll see a lot of mismatch in what someone thinks they're doing and what's actually happening. So, I go through different cues, like, because you're going to hear different things, like, okay, hold your breath, do the Valsalva. Oh, but then my pelvic PT or like my doula told me not to do that. Like,
Hmm.
what do I do?
Right. There's like a lot of conflicting information in the
Mhm.
moment, I think. Absolutely.
Yeah, so we work through that, and then I say, okay, well, let's see what happens if you do hold your breath and push. And then I tell them, okay, yeah, I feel the pelvic floor opening, or nope, it's tightening.
Mm-hmm.
Or okay, let's exhale and do it. Let's try to push more from your upper abs. And And so it can be really interesting to see, and I think empowering for the person too to get that
Mm,
feedback and then
absolutely.
feel like, oh yeah, like I can do this.
My
And
body is capable. Yeah.
Mhm.
Mm,
Yeah, and even if you do end up getting an epidural when you're not feeling what's going on down there, you can at least have the confidence knowing like, okay, I've my body has done this before. If I'm feeling this like abdominally and I'm doing the breathing right, hopefully my pelvic floor is
I'll
responding like
work
it.
with that. Yeah,
Yeah.
absolutely.
And even
Interesting.
though in the moment, of course, you can't like fully predict what's going to
Right.
happen, I think that just that confidence and knowing more about your body goes a long way too.
And I would imagine that the manner in which someone pushes, the awareness they have, the knowledge they have around it, how they push affects their what we call tissue separation, right? If people are getting a first
Mhm.
degree, a second degree, no tears at all. And everyone wants obviously to avoid third and fourth degrees. Those are not fun to heal from. And we
Mhm.
have some control over that, correct?
Yes.
Okay.
Yeah. So perineal stretching or massage, whatever you want to call it, can be
Prior
really
to, like this is prior to
prior to
pushing. Yeah.
prior. Yeah, really helpful. And you'll hear people say start at like 34 weeks, 36 weeks. I've started with people way earlier on if they already have a known hypertonic pelvic floor. So I had a patient who was referred like right away, like first trimester even, like it's okay, start now by her provider. She was
Hmm.
cleared, and so, in her case, she needed a lot of work. But in general, even if you start those few weeks before, um, the research that I know of shows that it can reduce your risk of tearing by about 1 degree. So if you're going to have like a third
Mm,
degree tear, you can expect maybe second degree or second degree maybe first. And of course that can be variable, and
right.
maybe that's just a way of trying not to give like false expectations like, okay, you do this and you're not going to tear.
Right. It's
But
not a
that's
guarantee, but
not a guarantee, but that's what I've heard. And then I also have seen a study that shows that if you do perineal stretching for about 10 minutes 3 times a week, there was no difference in outcomes if you did it, say, 10 minutes a day every day.
hmm.
So I'd like to tell that to women,
Oh, yeah.
just
They don't have to
to
be perfect about it.
yeah, to help
Yeah.
take some pressure off because there's so much going on, so many things to do. So, I think anything you can do is better than nothing.
Hmm.
And I also think that like we talked like the pushing mechanics, like the like autonomic nervous system calming, like that can go a long way too. So like the physical part isn't everything. Like it's significant,
Hmm.
but it's I think it's just part of the picture.
There's a lot more to it. So
Yeah.
in the time we have a couple minutes left. So tell me
Mhm.
like traditional pushing. I don't know if you're familiar with that, what that is, but it's
Mhm.
push with all your might, hold your breath, push 3 times in a contraction, curl up, hold your head up
Mhm.
off the bed, pull back your knees. Like that's what people are going to be faced with
Mhm.
typically, right? Is that okay? Like how can we improve upon that? What other advice can you give alongside that or instead of
Yeah.
that?
So I I think I mean I guess it's good that their women are getting some advice, but
It's
um
in the moment though, right? It's
it's in the
like,
moment. Yeah,
quick,
yeah.
do
Like
this. Yeah.
it's good to have that guidance. And I think it's hard because like as a pelvic PT, you kind of want to think about like the ideals, like, oh yeah, like this is the right way, but I
Hmm.
think we have to acknowledge like, okay, in the moment things aren't going to be perfect. So I think that pushing, like holding your breath and pushing can reduce the risk of prolapse. Um, but what I've seen is that if you are able to do it in a way that your pelvic floor can relax and get out of the way, then you're going to be a lot better off. So I
Mm,
tell this to people with when we're talking about like bowel movements as well. So you don't want to
mm,
hold your breath and push, but if you're absolutely going to and need to, like we got to make sure that pelvic floor isn't like tightening as a reaction,
mhm,
because if you're holding your breath and pushing and the pelvic floor is tightening, then that pressure's got to go
mm.
somewhere. And
You're
then
fighting yourself, right? Like,
yeah. And it's probably going to push into like those soft tissues where we don't want it that
mhm,
can create the prolapse.
mhm,
So that's why I like to prep both ways. Like, okay, ideal world, let's exhale and push, but let's also practice with the breath holding because
mhm.
I know that you might end up doing that anyway. So if you're going to, let's prep the pelvic floor for it.
Okay. I like that because people are going to be faced with that 9 times out of 10, just the
Mhm.
way the way the birth culture is.
Yeah,
And their goal is let's get a baby out, right? And I think
exactly.
you're looking at like we have a pelvic floor, we have a woman's pelvis who has to continue living, right? Like we have a
Mhm.
lot of
Yeah,
life left after just
yeah,
getting this baby out. How can we
yeah,
do that in the
yeah.
most beneficial way? It's
Mhm.
out long-term outcomes, not just yes, get the baby out in the
Yeah,
fastest, most efficient manner, but how can we be better off afterwards, which
yeah,
is important. That's a long time.
totally. And I think gravity goes a long way too. If you can get
Yeah.
into like any upright position, then which I know is talked about in some of the other podcasts, like that can really help open things up and help the pelvic floor even get encouraged to open up
A
in
lot
the
of
right.
times changing position during pushing, which is a lot of
Yeah.
times over an hour, we can do some shifts in
Mhm.
that hour. So,
Yeah.
okay, cool. There's a lot of work to be done there in the birth room because they're pretty scripted, honestly, in a lot of what they not at every facility, not with every provider,
Mhm.
but there's some pretty predictable patterns there for sure.
Yeah. Yeah.
So wrapping up here, because we have another episode. We're gonna talk about postpartum, which is exciting.
Mhm.
Um, to wrap it up, what are top tips you would give someone who's pregnant, who knows they're going to be having a baby? What's a reasonable course of action they could do to prepare in the best way?
Yeah, so I think the obvious is see a pelvic PT throughout the span of the pregnancy, whenever you can come in. Use your resources. If you have any um, free classes or access, then take advantage of that. And one thing that I do see often that I would like to spread the word is to exercise and move as as much as you can as early as possible. And take that with a grain of salt. Like I know, um, you know, there are so many limiting factors. So,
Mm-hmm.
but I'm saying more in the cases of if there's fear around movement, like, oh,
Okay.
should I be doing this? I'm nervous about this. And even if you might have like, maybe like a little bit of pain and achiness, um, it's beneficial to, work through that or like see a pelvic PT to try to work through that. Because I see women that can stay active have so much more success. And
Mm,
of course, it's easy to overdo it, but because we have that increasing laxity, we really need that stability and the
mm,
strength. And because I see a lot of women when they start to have pain or get nervous about movement, they overstretch.
mm.
So I do so much stretching and it helps a little in the moment, but then now my sciatica,
Oh, yeah.
it's if you can, um, try not to be too afraid of exercise and don't overstretch. Do it if it
Okay.
feels good, but don't only focus on stretching because you need the strength and stability to supplement. Otherwise, you probably will
Mm.
will end up having some pain.
Good tip. That's a really good tip. That's cool. Well, thank you so much. I think that gives awareness is key to so many things. And I think it gives us such a great awareness of
Mhm.
addressing regular pregnancy pain, addressing better outcomes for moms' bodies with
Mhm.
delivery and pushing. And there's a lot of things to know about and to learn, which is people have a course of action they can take. So
Yeah, yeah, and I acknowledge I don't know everything either, you know. This is just from my knowledge. So, yeah.
we're all learning together,
We're
which
all
is
learning. Like I feel
is
like I learn new things all the time. Like knowledge is constantly changing.
it's
So,
so true. It's so true. It's good to stay on top of what we can. So, well, Dr. Kasha, thank you so much for being with us today.
yeah.
This has been very helpful. I sure appreciate it. So, appreciate your time. Thank you.
Yeah, thanks for having me.
It's a pleasure. So, to wrap up our episode today of the Ordinary Doula podcast, again, we encourage you to reach out to someone, make a human connection. We are so important to each other. We need each other. So, please reach out to a human today. It'll make a difference in your life and in theirs. We'll see you next time.
Thank you for listening to the Ordinary Doula podcast with Angie Rozier, hosted by Hatched and Latched. You can find episode credits in the show notes and more information by visiting hatchedandlatched.com. If this podcast has been helpful to you, please leave a rating wherever you listen to your podcasts. Your support helps us continue having thoughtful conversations about birth, breastfeeding, and postpartum life. Be sure to tune in next time as we continue exploring the many experiences, questions, and realities surrounding the journey into parenthood.